And I love Churchill because it's a very authentic and
we were
real
really
place
drawn
to
to this community because people were so accessible.
I love Churchill really because it's one of the most beautiful communities I've ever seen.
A lot of people have to go outside of the neighborhood, like to places like Walmart and things like that, just because we don't have a large variety of grocery stores where we live.
You don't have a high access level to basic foods, like basic healthy foods of any kind. The primary access point are corner stores, which are these tiny places that actually make most of their money selling alcohol, cigarettes, and junk foods.
And these corner stores don't have produce. They don't have a lot of times healthy dairy options or things like that that might provide better nutrition for kids.
And then when you did have access to something like milk, there would be somewhere close to 100% markup. So you would go to a grocery store in the suburbs and you would pay $2.80 for a gallon of milk, and then you would walk down the street to a corner store and pay $6 for a gallon of milk.
When you're sort of living day by day on more of a survival mode, you tend to think more in short term.
And I was pregnant with Harmony, my first child. I wasn't working because I was completely sick the whole time with her, and I only received $113 in food stamps to feed me and a growing child inside of me for a whole month. And it definitely played a factor in what I would get. And because the oodles and noodles were X amount of noodles for $1 and some change, that's basically what I lived off of for a long time, and it really wasn't healthy.
You see a lot of people that buy like TV dinners and stuff like that and like eat that every day, so they're taking in like thousands of calories every day.
I don't think that it's fair for certain people to be able to have better foods than others. Well, even like for children, in instance, how can you expect a kid to be able to like make smart food decisions if they don't have the options available to them? And how can you expect people to eat healthy and get better if they don't have the options available and near them?
A community that is plagued by addiction, especially to alcohol, or addiction to fatty foods or high sodium, guess what? Your kidneys aren't going to last very long. Well, the dialysis clinic, which is, in my opinion on that, is just, it's kind of hilarious in a sad way. That used to be a grocery store. Now, it was not a great grocery store. It was more of the corner market. It used to be called Community Pride, which was also ironic.
Once the store closed, we were all hoping for a Trader Joe's or for something that offered healthy food. And the antithesis of that happened, dialysis, which again is the end of the spectrum. Your kidneys are already gone. You've already had diabetes for this long. There's no prevention there.
We're going to go to the corner store and get a bag of chips after school, and that's going to be one of their meals for the day.
A lot of popular snacks are like hot Cheetos, hot fries, Doritos, Funyuns, stuff like that.
Oftentimes I'll see a student will either be like very unhealthy, maybe like extremely overweight, or almost like the opposite, almost teeming like on the edge of like not being nourished enough. The diet that they have, it doesn't give them enough sustained energy to do things like sports, and for that matter, focus on anything else like homework.
A lot of kids that are a lot smaller than they're supposed to be. We've got a lot of kids that are obese, yet can barely make it through a day.
The biggest determinant of health is lack of access to nutrition.
Because nutrition, for the most part, is something that is more of a long-term thing. It's not what you eat today that's going to kill you tomorrow. It's what you eat over 10 or 15 years that will eventually have a cumulative effect. I think that's one of the reasons why it's so subtly dangerous.
I'm almost 40. And yeah, I run into people who are my age who look like they're 60 and 70 years old because they're existing on a diet that is going to kill them and is killing them very, very rapidly.
So working with people who have chronic disease in the city, a lot of them share very common risk factors. Common risk, if you're thinking about diabetes or high blood pressure or high cholesterol, sometimes age, certainly obesity, and then also hereditary as well. So African Americans have higher percentage of diabetes and high blood pressure.
Being a single parent and trying to raise my 5 kids by myself is really tough. I'm a business administration student, and I also work for the college that I attend. And then on top of that, I have a second job at night. I have arthritis in both of my knees, and that contributes because within the last year, I have gained at least 120 pounds from what I used to be. And that mainly is because I'm constantly on the go. And then when I'm at home, I'm trying to recover.
Listen, if someone shows up at a hospital, we're going to take care of them. Because that's what our legal system says, we're going to spend a lot of money. We get a lot more bang for our buck with public health interventions, and much less with giving people access to medical care.
You know, if you can educate in the context of relationship while also giving access, there's a good chance you can start to change habits. And what we're really talking about when we talk about nutrition are habits and access. These are real people. They have real names. These aren't just really poorly educated kids. These are beautiful kids, like, that have real names, and they really want to have futures, and they don't know how to get there.
I want all 5 of my kids to go to college. I want them to be healthy and fit so that they don't have to worry about the issues that I go through. They are my everything.